positive news for a change, I want to talk about progesterone and sleep in perimenopause and menopause, because this is like a huge win and something a lot of people don't know about. Did you know that progesterone is amazing for sleep? It actually almost acts like an Ambien. You take it and you fall asleep more easily, you sleep through the night. A lot of people perimenopause, menopause wake up at like 2 to 4 a.m. and then they can't get back to sleep. It really helps people sleep through the night and then they feel more rested in the morning. So yeah, 2 patients come back for follow-up that have been absolutely miserable. So not sleeping, totally exhausted, no energy, irritable. They also had like joint aches and pains, the hot flashes, night sweats, like the whole 9 yards. So both patients, we talked about all the options, including estrogen, and they chose progesterone alone because their main issue was the sleep. And so like I explained it, the sleep is sometimes the first domino that leads to the mood problems, the fatigue, the joint aches, the skin changes, etc. And they both came back today totally transformed. They're like, this is like a miracle. Like, why don't people know about this? Sleep is fine. All their other symptoms resolved because they now had energy, like their body was restored. You feel pretty terrible if you're getting like 3 to 4 hours of sleep a night. You're going to feel awful. And progesterone actually helps with things like the hot flashes, night sweats as well. It's maybe not as effective as estrogen, but it does still have that effect. So if you have like mild symptoms, it actually can be enough. One of my patients has a history of breast cancer, and she gave me permission to share this to raise awareness because I know everybody kind of hears hormones and they think breast cancer. So her type of tumor is ER/PR negative, meaning it's not responsive to hormone like most breast cancers are. That being said, we're still very careful about talking about all the risks and potential benefits, etc., in anybody with a history of breast cancer. That being said, we also have to think about the benefits of something. So just like the acetaminophen and autism thing, we don't just look at the risk. We have to look at the risk of not doing something and the risk of the alternatives. So people who are sleeping horribly, they have a much higher risk of things like cardiovascular disease, diabetes. If she has no energy to exercise, which she didn't, that obviously again is a higher risk to her overall health. So you have to put into context that in general, like she is, mentally in a much better place. So we have to think about all of these like lifestyle considerations and not just be like, well, there's a theoretical risk of cancer, so we're just not going to give you this at all. And she is absolutely thrilled. And it's interesting, her sister, who doesn't have a history of breast cancer, was told because you have a family history of breast cancer, you're not allowed to have any hormones at all. And that is absolutely not true. It is not a contraindication because basically everyone has a family history of breast cancer. So point being, talk with your doctor. There are so many different options, and it's important to kind of look at each person as an individual and not just to kind of say blanket statement, everyone should get hormones or nobody should get hormones.